Hi everybody. So INICT is finally over. So it's a time to relax. तो ज़्यादा time नहीं लेंगे. Just quickly we'll see the answer and we'll see why this particular answer has been chosen as the right one. As such, paper बहुत मुश्किल नहीं था. It was not a very difficult paper because somehow अगर आपको एक option नहीं भी पता है, you can easily rule out 3 options. That's what I noticed, that it was not a very difficult paper. Good. ठीक है, क्योंकि बहुत डिफिकल्ट पेपर बनाने से देयर इज आई डोंट सी एनी सेंस इन मेकिंग अ वेरी डिफिकल्ट पेपर. चलो, नाउ आई विल जस्ट स्टार्ट. Here, so let's start with OBGY recall. Let's not waste a lot of time because relax भी करना है, right? चलो, pregnant female with 10 raised to power 5 per ml bacteria in urine, ठीक है, and symptoms are of UTI. तो symptoms present हैं और this much bacteria, this much colony forming units per ml indicates it's a case of UTI. अगर symptoms नहीं होते तो asymptomatic bacteriuria कहलाता है, right? So this is UTI declared, diagnosed. Okay, what is the most common complication in this condition? So UTI is not a very good thing in pregnancy. तभी हम pregnancy में asymptomatic bacteriuria को treat करते हैं. Why do we treat asymptomatic bacteriuria? क्योंकि हम नहीं चाहते कि उसको UTI हो. Because UTI has lot of complications, among which अगर आप obstetrical complications की बात करें तो most common is preterm birth. So preterm birth is seen in almost 11% of patients who suffer from UTI. So it is most common. Next common होता है IUGR. That is next common, seen in almost 8%. Next common होता है preterm rupture of membranes. So this is the sequence. Most common is preterm birth that can happen in UTI. That is why we always treat asymptomatic bacteriuria. ठीक है? Easy? Okay. Next question. So women with infertility and irregular cycles. सबसे important क्या है भी? Infertility है, उसके साथ irregular cycles. Laparoscopy में chromoperturbation shows both fallopian tubes open. We'll keep these 3 things in our mind. Now this was the image. So somebody said there were both the ovaries were seen and both seemed enlarged. So this looks enlarged, definitely, right? It looks enlarged. What can be the cause? Endometriosis, ovarian cyst, tumors. So ovarian cyst will not lead to infertility. Tubo-ovarian mass, yes, it can lead to infertility. Why? क्योंकि tubo-ovarian mass क्या करते हैं? पूरी tubes and ovaries are stuck together, resulting in tubal infertility. पर भाई यहाँ तो tubes are open. So it is not tumors. ठीक है, what it is? अगर irregular cycles भी हैं with infertility, it is PCOS. PCOS is something which has irregular cycles. ठीक है, endometriosis में ovaries are not enlarged. ठीक है, so simple, it was very straightforward. PCOS. Which drug is not used in PPH? See, prostaglandins का ना बहुत ज़्यादा use है. Prostaglandins are used in almost everywhere in obstetrics. But every compound of that prostaglandin has a specific function depending on how it acts. जैसे misoprostol होता है, misoprostol act on the uterine receptors irrespective of gestation. उसको कोई फर्क नहीं पड़ता gestation से, इसलिए आप misoprostol को first trimester में use करते हो और PPH में भी. But जैसे PGF2 alpha है, carboprost acts on the uterine muscles in 3rd trimester when the receptors are sufficient in number. So that is why carboprost has to be used in PPH. Dinoproston, that is PGE2, that is a drug which causes cervical softening. So when it is causing cervical softening, will we use it in PPH? No, it is used in induction of labor. ठीक है? Oxytocin तो drug of choice है. Rotterdam criteria we have discussed lot of times कि Rotterdam criteria को हमेशा HPO से याद रखते हैं. There is features of hyperandrogenism, या तो clinical features होंगे या फिर blood reports will show you hyperandrogenism. Polycystic ovaries will be there and OC anovulation. How do you know anovulation? Women will have irregular cycles. Anovulation में हमेशा irregular cycles होते हैं. Or infertility, that will indicate anovulation. Any 2 of these is present, that is Rotterdam criteria positive. Delayed menses and hirsutism. Insulin resistance or obesity are the minor criteria of PCOS. They are not the Rotterdam, they are not included in Rotterdam criteria. ठीक है? Okay? Which of the following is false about Turner syndrome? So Turner syndrome is X0, comes with primary amenorrhea due to dysgenetic ovaries. That is why you read them in obstetrics. They have a lot of other stigmata, starting from head, low hairline, webbed neck, increased carrying angle, short force metacarpal, ठीक है, widely spaced nipple, shield chest. What you have not read in Turner syndrome is prominent occiput. Prominent occiput किस में देखा गया है? एडवर्ड सिंड्रोम में प्रोमिनेंट ऑसिपुट होता है. सो टर्नर सिंड्रोम हैज these three but not prominent occiput. Okay. 58-year-old female with adnexal mass. अच्छा, ovarian tumors पे इस बार बहुत क्वेश्चंस आए, राइट, बट नॉट वेरी डिफिकल्ट. सी एडनेक्सल मास है, 58 years old है, CA125 रेज्ड है. इसको पढ़ के हमें क्या समझ में आता है? एपिथेलियल ट्यूमर है. आफ्टर 50 एपिथेलियल ट्यूमर इज मोस्ट कॉमन. CA125 is raised in epithelial tumor, ये हमें समझ में आता है. On laparotomy, omental caking is present, ठीक है, and there was an ultrasound image of given which showed bilateral ovarian mass. So that's what I got in recall, that ultrasound showed bilateral ovarian masses. So when there is bilateral ovarian masses and ultrasound shows two ovaries, see serous or mucinous are epithelial tumors, ठीक है. Brenner भी है, but these are the most common one, right? CA125 is raised in both of them. But remember, serous is bilateral. Most commonly, serous is bilateral, mucinous is not. दूसरा, mucinous are huge. So जो आपको image दी थी, उसमें they were not huge. So mucinous is ginormous, more than 10 centimeter tumors. So they are huge tumors and unilateral. Whereas serous can be bilateral and they are not huge. They are smaller than that. They are, see, this is the image. This is a serous tumor. They are unilocular. एक cavity होती है. ये होता है mucinous. So many cavities and huge. So answer is serous tumor. Okay. Arrange the steps of pap smear. Very easy. अब pap smear किसी का लेना है, how will you? What will be your steps? First of all, आप उसको lithotomy में रखोगे. Then what will you do? You first want to see the cervix. You will do perspicular. Will you do PV first or you will take the sample first? अगर आप PV करोगे, then your sample might get distorted. Your gloves particle and other infectious particles might enter the vagina. So you will never do PV. First, you always take the sample. You don't need to do the PV unless it is needed. हम क्यों किसी की PV करेंगे when it is not needed? So if somebody has come for pap smear or HPV or liquid based cytology, lithotomy position में रखो, open up the vagina, see the cervix, take the smear, come out. You don't do unnecessary PV in anybody. So answer is A, C, D. Sorry, A, B, D. Which of the following is not the clinical use of Maxilf? यानी कि बाकी सब clinical use हैं, कौन सा clinical use नहीं है? Two very obvious options कि जो clinical use है, that is neuroprotection. We know that every preterm baby has to be given Maxilf. Other than that, we know for controlling seizures, very obvious. Confusion इसमें थी. क्या प्लासेंटल एब्रप्शन प्रिवेंट करने के लिए मैक्सेल्फ यूज करते हैं? यस. अ हाइपरटेंसिव पेशेंट इज अ वेरी हाई रिस्क ऑफ एब्रप्शन and Maxilf, no, directly not used, but yes, if you are giving Maxilf, you are saving her from abruption, you are saving her from seizures, you are saving her from abruption also. So this can be considered an indirect clinical use. क्या renal perfusion बढ़ाने के लिए Maxilf देते हैं? Do we give Maxilf for increasing renal perfusion? No. Why will we give it? It is not used for increasing renal perfusion, and neither it is used for that purpose, right? So this is our answer. It is not used for increasing renal perfusion. Which antiepileptic is absolutely contraindicated? That was the question. दो चीजें हमें पता है, that levetiracetam and lamotrigine are one of the safest antiepileptics. ठीक है, that we know. Oxcarbazepine, yes, it is said that it should not be used, but which one is absolutely contraindicated due to neural tube defects? Valproate. Absolutely contraindicated. So whenever a patient comes to you for pre-pregnancy counseling, she's taking valproate, you have to stop valproate. That is what is clearly written in guidelines. You can't use valproate. Okay? So that is absolutely contraindicated. Okay? Legal age for consent of MTP. So now this is a confusing question. क्या legal age है? ठीक है, for consent. So अगर question यही था, legal age for consent of MTP, if this was the question, it is straightforward. आप consent दे सकते हो only when you are above 18. Below 18 you are a minor, you can't give consent. अगर क्वेश्चन था लीगल एज फॉर एमटीपी, अगर ये क्वेश्चन था व्हाट इज द लीगल एज फॉर एमटीपी, सी एमटीपी तो माइनर करा ही सकता है, आप उसको प्रेगनेंसी थोड़ी कंटिन्यू करने दोगे. इनफैक्ट माइनर कैन हैव टर्मिनेशन टिल 24 वीक्स. So this is not a question. What is the legal age for MTP? Anybody who is getting pregnant and minor especially should get MTP. So the question basically was, अगर question ये भी था legal age for MTP, तब भी question का मतलब यही था कि at which age a girl can come to you for MTP with her own consent. अपनी मर्जी से वो कौन सी एज के बाद MTP करा सकती है. Even when consent was not mentioned, then also they mean this. ठीक है. So at what age she is legally allowed to have MTP by her own wish? That is 18. Okay? So this was the question that I can interpret from the language of the question. Okay? When can PPIUCD be safely inserted? So PPIUCD can be, we have discussed that PPIUCD को हम कब कब डाल सकते हैं. One is immediately after delivery, जिसे हमने कहा immediate postpartum. If she has not get it done immediately after delivery of placenta, उसने नहीं डलवाया है, she still has a time of 2 days. Within 48 hours, she can still get it inserted, but not after 48 hours. उसके बाद नहीं. ठीक है, ये हुआ पोस्ट डिलीवरी. अगर हम बात करें इंटरवल पीरियड में when she is not pregnant, so in that interval period when she can get IUCD, see, एक बात समझ लो that IUCD can be inserted any time. Because why? जबकि OCPs के साथ ऐसा नहीं होता. OCPs have to be taken within day 1 to day 5 of menses. Because OCPs को act करने में time लगता है. That is why first 5 days. Because they take time. आपने किसी और दिन डाला, किसी और cycle day में डाला, you have to use 7-day protection. It is not true with IUCD. As soon as you insert IUCD, it starts functioning. So you can insert it at any time of the cycle and you do not need to give extra precaution. Only thing is, make sure she's not pregnant. That is the only thing. Make sure she's not pregnant. So if they are asking safely inserted, आप कभी भी insert कर सकते हो. But it can be safely inserted 4 to 5 days of menstrual cycle. Because 4 to 5 days of menstrual cycle में you know she is not pregnant. It can be safely inserted. Can it be inserted 7 days before menses? 7 days before menses मतलब वो luteal phase में. यार आप insert कर सकते हो, but you have to check whether she is pregnant or not. And she might be pregnant. You might miss it also. So it is not very safe. I will not consider it as very safe. So this is the answer. These three are answer. You can insert it in these 3 times. ठीक है? In all the following condition, fetal bradycardia is present. मतलब slow fetal heart rate is present, except abruption हो जब whenever there is fetal distress, जब भी distress होगा fetal heart will fall down. ये हमने पढ़ा है. Fetal deceleration is a sign of distress. Acceleration is not a sign of distress. Placental abruption से distress होता है, so bradycardia होगा. Congenital heart block में yes, there is fetal bradycardia present. Cord compression, again it will cause variable decelerations. Fetal heart rate will fall. Maternal fever will result in tachycardia in mother. And this tachycardia will in turn cause tachycardia in the baby. So it is cause of tachycardia in fetus, not bradycardia. Okay. Which imaging modality is contraindicated? MRI and ultrasound are one of the safest one. And Doppler. They do not have any radiations. MRI has magnetic field, ultrasound are sound waves. It is CT scan which is the one which is contraindicated in pregnancy. This is the most common and I think all of you might have marked it correct. अगर आपको 20 weeks के अंदर MTP करानी है, you need opinion of only one RMP. ठीक है? If you fall in the category of 20 to 24 weeks, you need permission of 2 RMPs. And beyond 24 weeks, you need permission of a medical board. Remember, last time question आया था, what constitutes medical board? है ना? So here answer is 2 doctors' opinion is needed at 20 to 24 weeks. Granular cell tumor, histopath दिया था जिसमें coffee bean appearance था, right? Gross specimen image was also given. The following tumor will show what? ग्रैन्युलोसा सेल ट्यूमर दिया है, हिस्टोपैथ में दे शोड कॉफी बीन. सो ग्रैन्युलोसा सेल ट्यूमर क्या एपिथेलियल ट्यूमर है? नहीं, इट्स अ सेक्स कॉर्ड स्ट्रोमल ट्यूमर. सो इट इज अ सेक्स कॉर्ड स्ट्रोमल ट्यूमर. विल इट सिक्रीट CA125? CA125 एपिथेलियल सेल ट्यूमर से सिक्रीट होता है. सो नो, Call-Exner bodies are present in granulosa cell tumors, and the marker for granulosa cell tumors is inhibin. ठीक है, so inhibin and LDH, all these are markers for granulosa cell tumors. ठीक है, CA125 is a marker for epithelial cell tumors. और epithelial tumors में कौन सी bodies मिलती हैं? serous cells स्पेशली क्या मिलता है? samoma bodies, है ना? So this is our answer. We do not find CA125 in granulosa cell tumor. Cervical cancer, which HPV is most common? We know that 70% are caused by 16 and 18. Which of the following is not an aneuploidy? Aneuploidy क्या मतलब? इतना हम पढ़ते हैं aneuploidy screening. What is aneuploidy? क्रोमोसोमल नंबर की abnormality को हम aneuploidy कहते हैं. When the problem is in chromosomal number, then it is aneuploidy. Trisomy 13 मतलब 13 chromosome पे there are 3 chromosomes. So the number has changed. Instead of 46, you have 47 chromosome. Same with trisomy 21. Klinefelter में भी यही है, XXY है. Again, you have one extra chromosome. Bloom syndrome is not a problem in number. Even when you don't know, अगर आपको नहीं भी पता Bloom syndrome, you know कि ये तीनों तो number abnormality हैं. These three are aneuploidies. You will mark this. Bloom syndrome is due to a gene defect in BLM gene. It is an autosomal recessive disorder where a lot of cancers tend to happen in that person. So it is not the problem in number, it's a gene defect. Okay? That's it. So these many were the questions. I have covered all of them. And if there is any doubt, please ask. But it was not a very difficult question, I must say. I hope all of you did well. And now relax and enjoy your day. Hope for the best. Bye-bye. Bye, everyone. Good luck for the results.